Hello, this is Dr. Zuleta from the Big Island of Hawaii. Throughout my career, people ask me many questions, just like many people in our field. And through these questions, people always told me that they wish that other people could hear these answers because it helped them go through a certain issue or it helped them have a little bit of better direction. So I decided to do a 6-series videos answering questions for people with the intention of helping out or giving them a little bit of useful information. The first question was done about hair loss, and now Mary asked us the second question, which had to do with strokes. She recently had a friend that passed, and she was only 34 years old. So speaks to the severity of issues like a stroke. And so very gladly we'll do this video and spread any information that can be useful regarding this issue. If we start talking about strokes, let's first start and say that strokes is the second most common cause of death around the world, the second most common one, and is the most common cause of disability by far. So it's a huge issue, creates a lot of disability for a lot of people. So if we look at a stroke, there's two types of stroke. One in which a clot travels up the vessels of the brain and is gonna get stuck in one of the vessels of the brain and the tissue is gonna die because there is no blood supply. The other one is one of the vessels explodes and it also causes the brain to be damaged afterwards. So if we look a little bit more closely into the second one, the one in which the vessel explodes, let's go into the brain and look at the structure of the blood vessel itself, right? And if you look at the structure of the blood vessel itself, you're gonna notice that many times, let's go in deep and see that the blood vessel wall is normal until with high blood pressure, it can rupture and the blood can damage the brain outside, and also upstream, that brain is gonna die because it doesn't have any blood supply. So that's the main issue with that. And then, so how does this affect people? Well, if you think about strokes or the heart, the brain as electrical activity, which this is what it is just a bundle of wires put together. You can see this beautiful picture of electrical activity in the brain. This is actually a real-time picture of somebody's brain. And it's just incredible how much electrical activity there is. So if you imagine just having a bundle of wires that are working on your hand and you add water to them, it's gonna go bust and it's gonna break and it's gonna burn. So this is the same thing with the stroke. Blood and brain don't go well together. And more specifically, if you look at this picture, this is a picture after a brain stroke. And how it affects the tissue of the brain. It almost looks like dead, which it is. A part of the brain really dies. And specifically, if you look at the brain, there is maps of the functions that the brain controls. So some parts of the brain control just on the left side, for instance, the motor functions, so the movement and the movement of the face, the movement of the hand, the movement of the toes. So it just depends which part of the brain dies off, and that will be the affected part. Here, we can see a viral video of this lady who was having a stroke.
It's all tingly on the left side, on the left side.
And she's having difficulty speaking also. And as you can see, she's gonna have weakness in her left arm also.
My hand is hard to lift up and to touch something.
And so you can see that she was having a struggle with her face. Some of her face was drooping, and also struggle with the hand. So does it only happen in older people? Not anymore. We're seeing that there is a 44% increase in people that are 25 to 44 years old. I mean, that's our age, my friends. And unfortunately, this is what we're seeing. So how do we know, how can we detect if our family members, if our friends are having a stroke? In the UK and the American Heart Association, they started this program doing this fast thing. And if you look at her brain, a stroke is almost like fire. It can spread like fire. And so the first thing to think about is think of F, face. And is the person's face changed or different one side of the other? You can see her eye is different. The next thing in the fast mnemonic is arms. Is the arm not moving, tingling, or numb? And the next one is S for speech. Is the speech slurred or is it hard for them to talk? And the next one is time, for 999 in the UK and 911 here in the US. And it's very important for us to get to the hospital as soon as possible, because you only have 4 hours and a half until they can give you the medication. If it's past that, it doesn't work. So face, arms, speech, and time. So what's the most common out of the two strokes? Well, the most common one is ischemic stroke. 68% of all strokes are ischemic, meaning that there is a clot that went up to the brain and it stopped the blood supply. And 32% are hemorrhagic, usually with high blood pressure or things like aneurysms, like little bubbles or blebs in the vessels. And so what are the risk factors? How can we prevent ourselves before even having any surgery? How can we prevent ourselves? What are the risk factors? Well, just like anything else, there is stressors. The first one is chemical stressors. Are we putting anything into our body that is a chemical stressor to our vessels and to our brain? Are there any physical stressors? Is there anything physically that is a stressor in our body? And are there any emotional stressors? And we're going to talk about that one because it's very interesting how that plays a role. A lot of times we think about the chemical and the physical, but later studies have shown that the emotional has such a big impact on this. And so if we look at the physical stress, obesity has a huge impact on this because it increases the blood pressure. And so that pressure inside the vessels is just ready to, it puts so much more stress on the blood vessels, making it easier for them to burst. The second one, the chemical stressors, the smoke is actually being proven to damage the blood cells of the brain. So it's easier to bleed. It's a lot easier to bleed. And the third one, emotional stressor, the American Heart Association actually did a study and it showed that if you compare people who don't have psychological scores of depression or chronic stress scores where they don't learn how to relax or high hostility, the people with depressive symptoms, 86% more likely to have a stroke. 86%, that is crazy. I mean, 86%. And 59% if you have a chronic stress score, meaning, we all get stressed, but are you balancing it out with something fun, with something that relaxes you, with something that makes you wind down? And then highest hostility, if you're hostile, if you have hostility, things that you haven't dealt with, twice more likely to have a stroke. So, we used to think that emotions didn't really matter, but they have a chemical effect on our bodies. And so, and here we're going to see how this works. Let's go into the blood vessels, and you can see the wall of the blood vessels is made up of these cells, and we're going to zoom into one of the walls of the blood vessels. And if you have high blood pressure or smoke or cholesterol, it's easier for them to break away. And so what happens when it breaks away, some of the red blood cells get stuck in this framework right in the blood vessels and platelets. And so the blood gets clotted and there's an explosion of inflammatory response. And this inflammatory response actually tells the body to send more inflammatory cells. And so there is all of these things going on at this time, and it sends these white cells that are going to eat all of this away. And you might think that this could have been a good thing, but actually it creates this plaque that is like foam, and it grows and it grows and it grows and it grows, and it starts affecting the blood supply to these areas. And the crazy thing is that the system starts building this little cap around it. These blood cells start building a cap around it like skin. But if you look at it from the other side, as we're going to go in now from the outside, this skin can burst open and one of these clots can come out into the bloodstream and travel up And the more you travel up, the more smaller the blood vessels get, and then it's gonna get stuck, creating a stroke. So very important. Any chemical, emotional, or physical stressors on these blood vessels can make them easier to be damaged. So how do we prevent this? How do we prevent this? Well, interestingly enough, primary nutrition and secondary nutrition. I talked about the primary nutrition concept in my last video. And, you know, I used to think of nutrition as just food, food, food. But now I understood this concept of primary nutrition, in which, you know, energy we get from other things, from being exciting, from being involved in things that take and engage us. And so, for instance, if you got a flight at 5 a.m. in the morning, you're going to be up at 4, getting ready to go, making it to the flight. Or some of us, you know, at 4:45, right before you get to the airport. But beside the point, you're going to be up, you're going to be going, you have energy. And whether you like it or not, you get going. The same thing if one of your family members has a huge event, you have a meaning. This helps you have more energy. The same with belonging, and the same with physical activity. It just helps you have good chemistry into your brain. If you go running, you get adrenaline into your brain, and endorphins and all of these things that are healthy for your body. One good way to exemplify this, because I know it's hard, even for me, it was hard to get this concept, is something called the blue zones. The blue zones are these areas of the world where people live long life. I mean, 100 years old, and they're pretty healthy and active. And so people went to study these and see what are they doing? What are they doing? And so they came up with something called the Power Nine. And the Power Nine is something that they found that these people do consistently, despite them being different cultures. And so one of the things that they found is that they downshift, meaning they know how to relax. They have different methods of relaxing, culturally different, but it gets the same point where people just chill out. The second one is purpose. They write down and they have a purpose. They all do. And so it's so interesting because they've studied that if you just write your purpose every day, it adds 7 years to your life. And also studies from Harvard and Johns Hopkins show that when you write your purpose, you're like 40% higher chance of achieving a goal, or if you write a goal down. So if you think about it, it'd be like 7 years of achieving things that you love. So in a way, it would be a fulfilling 7 years added to your life. So it's pretty cool. A lot of plant. These people eat a lot of plant. Wine, for those of you who drink or don't drink, but they do throughout these cultures that live long, they have a little glass of wine with dinner. Is very common to see that. Family, they're very focused on family. 80%, I think this is so interesting for our culture, that 80%, if they feel full, they stop eating. They don't wait until they're 100%. They notice this in all of these cultures. They're naturally active, so they don't necessarily go to the gym or anything like that, but they're active in their houses, in walking. They walk long times. They walk in their gardens. The right tribe. Then the other thing is that they have a group of friends, group of community. They have a lot of events like that, and they also have a good sense of belonging, meaning that they are a part of a faith-based organization, or an organization that teaches values that are time transcendent, that are more than today or tomorrow, that values that kind of carry you through the years. So pretty interesting. So I just wanted to exemplify this because that goes into a primary nutrition, that all of these things give us energy. And then so we go about secondary nutrition, that's the food. And so pretty cool that the American Heart Association did a study, and actually apples, if you eat an apple a day, you lower your risk of a stroke by 52%. And it's a pretty large study that they did. And so why is that? Well, because they found that in fruits or vegetables that are white on the inside, there is a lot of two things: fiber and quercetin. And so the fiber is good because it lowers your blood pressure, and the quercetin is good because it prevents the formation of plaque. So it is right. One apple a day will keep the doctor away. So if you've done all of these, and there's certain things that we can't control in life, and unfortunately this happens every day, and you happen to have a stroke, or one of your family members, get to the hospital as soon as possible, because there's a time window. Don't drive, call the ambulance, because the ambulance will set off a response in the hospital called a stroke code, meaning that they get everybody in the team ready to go for when you get there. Everything is ready. There's a little box with everything on it so that it's ready for you. And one of the things is medications. So if you get to the hospital and you have an ischemic stroke, you see the plaque forming. The plaque is forming, just like we saw in that video. More platelets and blood vessels and blood cells form there, and they get bigger and 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 bigger. And then the blood supply to that part of your brain on the left is going to start going down, and then there is a thrombus that can break away, and then it goes up and it travels up into your brain, into a specific area onto your brain, until it cannot go any longer, and then the blood supply stops, and then that part of the brain is going to start dying. Well, what to do next? If you get to the hospital into 4.5 hours, you have a chance. So if we look deeper into this blood clot, it has some framework. It has a scaffolding. And don't worry too much about the name there, but it has a scaffolding that pulls it all together with different proteins and so on. So if we give this medication called TPA, it goes right into it, and it breaks apart the scaffold, and it kind of disintegrates it, so that the blood clot is able to dissolve. And as you can start seeing, it's going to start dissolving and dissolving and dissolving. And this happens pretty quickly. This happens in the hospital all the time, but the medication is extremely dangerous. You have to be in the ICU, in the intensive care unit, and people die from it sometimes, but it also saves a lot of lives and a lot of people. The second way that they can treat the strokes, and let's go into one of the blood vessels in your head so that we can exemplify it better. Through your one of your veins in the leg, they go in with a little catheter, and that little catheter is taken up to the brain, slowly going up to the brain until it finds the specific part where the clot is seen on an MRI usually. So the thrombus gets aspirated, as we can see now. They'll take the little lead right up to the clot, and then turn out a little bit of a vacuum that will go in and take the clot little by little. As you take the clot little by little, more and more blood supply will start going into that area of the brain again, and it's almost like turning the water back into a plant. You want to do it in time before the plant is dead, and if you do, then the plant starts looking more alive. And so the same thing with the brain. So that's one way to do it. There's another way to do it, that they got a thrombus removal wires and devices and they grab the thrombus and then they pull it out, and they pull it all the way out down through the leg. And so when it's done that, then the blood supply can return to the brain. So this is in essence why strokes are so important. What is a stroke? What can we do to prevent it? What are the different types of treatments? And some things in our life we can prevent. Unfortunately, we're all here, and death is imminent for all of us. And so instead of being scared of it, there is this concept that we can actually use it to live more full lives. And so this poem by this chief Tecumseh is a great example of that. He says in this poem, he says, "Live your life that the fear of death can never enter your heart. Trouble no one about their religion. Respect others in their view and demand that they respect yours. Love your life, perfect your life, beautify all things in your life. Seek to make your life long and its purpose the service of your people. Prepare a noble death song for the day when you go over the great divide. Always give a word or a sign of salute when meeting or passing a friend, even a stranger when in a lonely place. Show respect to all people and grovel to none. When you arise in the mornings, give thanks for the food or for the joy of living. if you see no reason for giving thanks, the fault lies only in yourself. Abuse no one and nothing, for abuse turns the wise ones to fools and robs the spirits of his vision. When it comes to your time to die, be not like those whose hearts are filled with fear of death, so that when their time comes, they weep and pray for a little more time to live their lives over again in a different way. Sing your death song and die like a hero going home. And so, when I grew up in Colombia, if there was one thing that I learned is that, life can go like that. A lot of violence at that point over there, and people just, a lot of people just went like that before you know it. And I told a story in my first video about this couple. And when I went in to pronounce this woman deceased right next to her husband, and I told him that she was passed, he was very calm and he told me that he was doing okay. And I asked him again because it intrigued me, and he told me I was good to her, she was good to me. And I think that puts it all together, especially with strokes. It can happen like this. It can take our life or the lives of our loved ones like that. Even if we do everything right, sometimes we might decrease the chances of doing and prolong our lives, but it could happen at any time to any one of us. So the lesson from this couple is that, she had a legacy that she left him. She had a legacy that, he's how much peace he was. She had something to do with that. And that legacy is every interaction that we have with every person. So it was very important to see that lesson for all of us, that every person that we come into contact is a legacy, and that's the legacy that we live on when we pass. So it was a pleasure doing this talk. Mary, my condolences for your friend and her family. And I hope that this information was useful to all of you. And thrive on. Thrive means progress and also means seizing the opportunity. So, any type of progress that you can make in any area of your life, and seizing any opportunity, meaning anything that you want to do, small or big, you know, that equals thrive. So, thrive on. All the best. Have an awesome day. And I'm looking forward to making the next video. Thank you.